Hi, today is January 23rd, 2022. Do you know that there are actually people that are looking forward to turning 65 and jumping on Medicare? Yes, it is true. And I'll tell you why. A lot of people in their 60s are paying a ton of money for their health insurance, whether they're paying for it through group health insurance or they might be entrepreneurs, they might be self employed, and they have an individual health insurance plan. And when you're in your 60s, those premiums are way, way expensive. So once they know what it's going to cost them on Medicare, they cannot wait to turn 65. Now, they may not want to turn 65 for other reasons, getting older and so on. But in terms of taking advantage of Medicare, they are excited. They're looking forward to it. And not only because of price, but also because they get to choose, they get to be in the driver's seat on original Medicare. So there's different enrollment periods that affects Medicare beneficiaries. One of which, well, first of all, let me backtrack. Let's just put out in the open, what exactly is Medicare? Medicare is the federal health insurance program for people that are 65 and older. But not only those that are 65 and older, there are many Americans that are on Medicare because of the fact that they are on Social Security disability. If you know anyone who is on Social Security disability, after 2 years, they qualify to go on Medicare, even though they have not reached that ripe old age of 65, which is really young in today's standard. 65 is not old today. So there are many people on Medicare. Some are 65 and older, and some are younger due to Medicare, Social Security disability. So how does one qualify to go on Medicare? The way we qualify is by working. When we are working, there is something that is called payroll deductions. So we're actually paying into the system during our working years. And you have to have at least 40 quarters. There's 4 quarters in a year. So basically 10 years of payroll deductions is what one needs in order to get Medicare Part A to be premium free, but you still have to pay for Medicare Part B as in boy and Medicare Part D as in David, and the Part D is the drug plan. So currently, we are in a specific enrollment or disenrollment period, I should say. We are currently in the open enrollment period, that is OEP, and that started in 2019. The first quarter of the year is the OEP period. And what does that mean? Well, let's say that you signed up for a Medicare Advantage plan last year during the AEP, the annual enrollment period. Now that happens every year from October 15 to December 7. So let's say you signed up for a Medicare Advantage plan back then, and you're not really happy with your Advantage plan currently. It's not really suitable for your needs. Well, the good news is you've got an opportunity, one opportunity to make a change. The change that you can make during OEP is you can switch to a different Medicare Advantage plan, or you can decide to go back to original Medicare, but you will have to answer health questions if you decide to get a Medicare supplement plan. And there are 4 parts to Medicare. So the annual enrollment period gives you more options. What can you do during the annual enrollment period? That is, again, October 15 to December 7. And if you turn on the television during that time period, you will see a ton of commercials that are touting Medicare Advantage plans that are, they say, 0 for this and 0 for that, and you get this, 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 and that in addition thrown in. So during the annual enrollment period, you can sign up for a Medicare Advantage plan. If you are on a Medicare supplement plan and you decide you want to sign up for a Medicare Advantage plan, that is a time period that you can do that. Or if you are on a Medicare Advantage plan and you want to go back to original Medicare, you can do that during the annual enrollment period as well. Or if you're on a standalone drug plan, that is the time that you could switch to a different drug plan if it suits your needs. Because the Medicare Advantage plan and the Part D drug plan are both calendar year plans, which means what? It means that they change slightly from one year to the next. So during the annual enrollment period, you have more choices and options. But during the OEP, which again we're currently in, and that started January 1, and it goes until March 31. So it's the first quarter of the year is the open enrollment period. So this is a time frame where you got to think about it and decide if you're not happy with your Medicare Advantage plan, now's the time to make a change. Now this OEP actually replaced a period that used to be called the Medicare Advantage disenrollment period. And that used to take place from January 1 up until Valentine's Day. But that period has been replaced with this period that we're currently in, the OEP. Now, a lot of people that watch television during the annual enrollment period from October 15 to December 7 tend to get a little confused because some of those commercials are not very transparent. Some of them are somewhat misleading. They can lead you to think that you can get everything for nothing. And that is not the case. A lot of plans are based on zip codes. So your zip code may not have a certain plan that the commercial is touting. So what can you do? Well, I recommend that you do your research, but preferably with an independent agent. Because, you know, when you research stuff on the internet, you could spend hours and hours and days researching it. Make it easy for yourself and work with an independent licensed agent. Somebody who's not just tied to one carrier or one type of plan and they only have one option to offer you, but somebody who's independent, who works with many different types of Medicare Advantage plans as well as original Medicare plans. And that is really in your best interest. And by the way, it does not cost you anything to work with an agent. It's actually to your benefit because that person can answer questions for you probably a lot quicker than you could find the answer by doing the research yourself. So take advantage of working with an independent licensed agent. It's to your benefit. So now we've covered, in summary, we've covered how to qualify for Medicare. That's by working. And as an independent agent myself, I do educational workshops in my local area, and we cover everything that somebody needs to know in order to make a wise decision about Medicare. We also cover the costs of Medicare, Part B and Part A. And if you'd like this sheet, I could certainly email it to you. Just need a good email address and it's on its way to you. So if you have any questions, feel free to reach out. I am more than happy to answer any and all questions. And by the way, if you have friends or neighbors or family members that are in other states and they have questions about their plan, maybe they're not totally sure of what they have. And a lot of people actually are not totally sure about what they have. Feel free to reach out. I am happy to help and licensed in many different states. By the way, did you know that the Medicare Advantage plans do vary by the area that you live in? And also Medicare supplement plans vary in price based on your zip code. I've had clients that moved out of Southeast Florida, like Boca Raton, as an example, who moved to Tennessee or Texas, and their premiums were half of what they are in Florida. Now, we have so many seniors here in Florida that you would think that we would get really good low premiums on Medicare supplement plans, but somehow that's not the way it works. So we can run quotes for your friends and neighbors, and we're more than happy to do that, and also give you some input as to which carriers we think are most appropriate based on your needs and your budget. And for those of you who do not have my contact information, here is my card. My number is on the screen. Feel free to call me, and I look forward to seeing you tomorrow.